Hello, I'm Stuart Roger. I lead the actuarial health practice at Deloitte, and I'm here today representing the Health Practice Committee because our convener Nick Stolk is having a baby this week, personally testing out our health system. We're the Health Practice Committee, but today I'll focus mainly on the subset of that industry which is represented by private health insurance. It's been an interesting year for the industry. We've had for the first time a decline in the number of Australians covered, first time since around about 2001. We've had a significant ministerial and government review of the entire sector, and the results of that were announced in October. There were some key changes that have been introduced. None of these are a silver bullet to deal with everything that would fix our industry, but each of them are worth doing. Let me just run through a couple of the ones that grab my attention. Significant cuts to prostheses costs, which will make a difference to the people's premiums. And then also for younger people, a discount has been introduced for people under age 30, and we hope that that will help to people covered properly. Communication is an issue as well, if you've ever tried to compare health insurance products, and a couple of the changes deal directly with that. One is that products will be classified according to the level of cover they offer: gold, silver, bronze or basic, and also the clinical terminologies that insurers use to describe what cover you have will be standardised, so that for the first time you can actually compare and see the wording is the same and understand whether each insurer is offering what you're looking for or not. There'll be better rural benefits for policyholders living in the country. The Ombudsman's powers will be enhanced and the comparison website that they run will be improved. In parallel with the ministerial review of the industry, there was a Senate inquiry into the affordability of private health insurance. This flushed out a number of attitudes to the industry, also explored a number of the causes of prices going up, which are really to do with the more and more money that we choose to spend on health in Australia. And so there's some useful stuff in the Hansard from that Senate inquiry. Leaving the government and looking more at the players in the industry, there were 4 new entrants to the industry, so it's not an industry which people are shunning commercially. And there was one sale of an insurer from Australian Unity to NIB, a strategic realignment for each company. One other thing to mention when you look at the industry, there are a couple of innovative approaches worth mentioning. NIB continued its offshore expansion and indicated an interest in expanding to offering health insurance in China in conjunction with a partner there, one to watch. And GMHBA teamed up with the life insurer AIA and the South African insurer Discovery Health to leverage Discovery's Vitality product, which is a wellness product, and through it create another new health insurer to explore a totally different health insurance market proposition. 2 innovative approaches worth watching. Underlying all those industry changes, our community rated system is internationally envied, and the underlying question is, what is it we need to do to keep it running properly? All those things that I've mentioned all bear on that question in some way. Governance and regulation. Both the things I'm mentioning now will come from APRA. The first one, CPS 220, the Risk Management Standard for Health Insurers. This is a job which FIAC started, the previous regulator, and APRA is now completing. And as a result of it being done by APRA, there's able to be standardised approach between the life insurance, the general insurance and the health insurance approach. So that's a good thing, and health insurers have been making sure that their standards are already compliant with what's required now from APRA, and they'll continue to do that on into the following year. The other thing APRA have done is formally include the health insurance appointed actuary role in its consultation about the role of appointed actuaries across life and general insurance. This is not a surprise. Health Practice Committee made sure that it would make comments about this, and the Institute's submission included already the health insurance view. Turning to the Health Practice Committee itself, a couple of appointments to note. Tim Goodhue has taken on the role of leading our Wider Health subcommittee. Wider health, non-health insurance, is the growing edge for actuarial work in health, and we wish Tim every success. Barry Leung has taken on the running of our education subcommittee. We had two other people join the Health Practice Committee, Brendan Pond from Medibank and Carlo Breitenbach from AGA in Queensland, and Nick Stolt carries on as the convener on into next year. Health Practice Committee's focus in 2017 and going into next year, we've changed a couple of the practice guidance notes, financial projections and the valuation of liabilities. We've also kept going our CPD training course and did a significant update of the content of that, launched in about March or April this year. We've run some events, and the biggest one that we've run was the Future of Health seminar. This is something we did last year for half a day, and this year we extended it to a full day in Melbourne. Significant attendance, the majority not from the Institute, which we are really pleased about, and we're also pleased that interest and attention kept going all through the day, so clearly expanding from half a day to a day has been appreciated by our key audiences. Through the year too, we also run insight sessions, and so we keep the focus on sharing health insights with the membership. The final one of those is the strand of papers that ran throughout the Health Summit in May. Other things we've done as Health Practice Committee, we've had two active ongoing subcommittees through the year, one dealing with education and the other one dealing with wider health. And we've also published several editions of our newsletter on private health insurance. This is a newsletter that goes to 1,800 people under the Institute's branding and is an excellent piece of publicity. Most of those 1,800 are not Institute members, and yet they get from the Institute their information on private health insurance industry. Good thing. Focusing for next year, we will keep our push on communication and events and sharing of information and insights, and we will also put an emphasis on that wider health subcommittee. With CPD, from this talk, you can see there's many ways to get involved in health, and if you're already involved, many places to get CPD, starting with our own Institute resources. For example, that mental health paper, green paper that came out in November. The insight sessions and summit papers that I've mentioned, and a number of other resources that you can get through the Institute website. Thanks to all members of the Health Practice Committee for your efforts during 2017, and thank you in advance for them during 2018. And finally, if you're looking to get involved in health, just do it. Health's not going to go away. Contact the Institute. Well, that's it. Thank you for watching and listening, and I look forward to seeing you in health.